whether it's our money or the governments like the UK money, I can say that health aid really is not much affected by corruption. There's been some confusion about that, but believe me, I wouldn't put my money into it if we weren't sure about that.
Well, Melinda, the British government is going to be involved with you tomorrow on this polio campaign. You managed to crack them first. One wonders how, and whether you've managed to get anybody else. I saw President Sarkozy was around you quite a little bit behind there. Did you manage to get him to do it?
Well, I think the thing to highlight here is the incredible generosity of the UK citizens and the government, and the fact that the government ring-fenced this part of the budget so that it could be used for humanitarian purposes. It's just incredible, and I think their leadership will make other countries want to come into this immunization campaign all the more, and we will be calling on lot.
Government, I'm sorry, mate, we're not going to put anything in unless you do put something in.
Well, I think everyone is watching because when you're talking about vaccination, you're saving lives for less than $2,000 per life. And amazingly, by having healthy children, what it does is the parents decide to have less children. They know several will survive to adulthood. And so whatever issue you care about, stability, the environment, all of those, the thing we need to do is make sure that we don't have these population explosions. And so I feel good about the money we spend on vaccines and getting other governments to do that, even in times when budgets are as tight as ever.
Well, here's a good...
I've just come back...
Sorry, carry on, Melinda, sorry.
I was going to say, I just came back from Kenya, and it's incredible to see this Alliance for Vaccines and Immunizations rolling out a new vaccine for pneumonial disease in Kenya. We know that pneumonia kills 1.6 million children a year. It's not just the money that comes from the alliance, from the donor nations, but also the Kenyan government is stepping up and putting their own money in and training their own workers to deliver this vaccine. So I think we see that whole countries are coming together and rallying around this cause, and that makes us really excited too.
Well, that takes us very interestingly to the very next question from Dr. Fouzia Sadiq. Do we just want a prophylactic drug, or do we really want to eradicate AIDS? What's your central drive?
Well, you have to be very careful which diseases you pick for eradication because that's very tough. Polio, we think we're there. This 2010 was a good year. With AIDS and malaria, right now, the tools we have should allow us to reduce the number of people who get sick quite dramatically. But with AIDS, until we have a vaccine that's highly effective, we won't be able to think about eradication. Now, we and others are funding that, but it could be 10 or even 15 years before we have that vaccine and we could put together such an aggressive plan.
But Melinda, wouldn't that money perhaps be better spent on behavioral change?
Well, I think you need to do both. I think what we need to say to people right today, and what we are doing as a world through things like the Global Fund, is saying to people, it's prevention is the tool we have today. Use condoms, practice safe sex, and until we can get the upstream tools like a vaccine, those really are our strongest messages. We can also do male circumcision, which we know brings down the rate of AIDS, and we can do a few other things like prevent mother-to-child transmission of AIDS. But it really, ultimately, in 15 years, it's really a vaccine that's going to change the whole face of that disease.
Somebody has just tweeted in that in India, for example, you do see large stockpiles of vaccines that are not properly distributed, and they're saying, can you really be sure when you say there's no corruption in vaccines that the job is being properly done?
Well, you can make sure it's done a very high percentage of the time so that your impact per dollar is incredibly high. I don't think there's any money a government spends that's as nearly as impactful as what is spent on vaccines. And we're constantly surveying, looking, making sure all the children are getting covered. We're getting smarter about how to do that. And so I'd say it's a very well-run program, despite small imperfections.
Here's an interesting one. What does the Gates Foundation do, brackets, if anything, for those affected by poverty in the United States, Melinda?
Well, I think the thing that we can do the most for people in the United States is get people a great education. Make sure that all students have a great education. And that's just not the case today. If you go into the public school system, which Bill and I do now quite often across the U.S., there are kids that are being totally not served and left behind. So we're trying to make sure that we change the U.S. public education system so that all kids have a great education.
That's not within the Gates Foundation, is it? It doesn't really fit your parameters.
No, it is. That is exactly what we do in the United States. So our law
are very much on the front line. Are you not uncomfortable with some of the performance of the drug companies?
I would actually say we're impressed with the performance of the drug companies. If you'd asked me a few years ago, would GSK be coming out with a new vaccine with specific strains around pneumonia that affect African children, I would have said, is that going to really happen? And it is happening. I just came from Kenya, and it took, where Bill and I, when we came into vaccines, it used to take 15 or 20 years from a vaccine to go from the developed world to the developing world. This new vaccine that's coming out, it's 2 years between the time it came out in a developed country to got to Kenya.
And what about,
that's impressive.
What about price and profit?
Yeah, actually, the pneumo vaccine, there was a commitment made to buy in volume to get a super low price. And so they offer it a fraction of what they're charging in, say, the United States, so that we can get it out to all the poorest kids.
I'm going to dip down to our last question, because I think it is a really good one. Melinda, to what extent does the Gates Foundation fund efforts of existing charities and NGOs and not duplicate work resources unnecessarily? So, Bill and Melinda Gates, it's a great privilege to talk to you. Thank you very much. And I know a lot of people are very grateful to you for what you've done to philanthropy and much more. Thanks a lot.